Okay, so I'm betting you're here because you want to know more about cardiac stress tests.
That's right.
Maybe you're about to have one yourself.
Yeah.
Or maybe you're just really into heart health.
Or just a curious person in general.
Exactly. We're all about diving deep here.
Love that.
And today we're going to figure out what makes these tests so important.
And trust me, there's a lot more to them than people think.
Yeah, I've heard that.
It's not just about, diagnosing if something's wrong.
Right.
It's a way to see how your heart handles pressure.
Like its own personal workout?
Exactly. It's sometimes called an exercise stress test for a reason.
That makes sense.
Because we're basically simulating a workout for your heart.
Okay, so walk me through it.
Sure.
What actually happens during one of these tests?
Well, there are two main ways we can do it.
Okay.
One is you actually exercise,
Uh-huh.
like walking on a treadmill
Oh, okay.
or pedaling a stationary bike.
Right.
And we gradually make it harder.
So it gets more intense as you go. And what if someone can't exercise?
That's where the second option comes in.
Yeah?
We can use medication to mimic the effects of exercise.
Oh, wow. So it's like tricking your heart into thinking it's working out.
You got it.
So it's really putting your heart through its paces either way.
It is.
But how do you actually, see what's happening inside?
Well, throughout the whole test,
Yeah.
you're hooked up to an ECG.
An ECG?
Yeah, it's also called an EKG sometimes.
Oh, okay.
It tracks your heart's electrical activity.
So you can see how your heart's beating under stress.
Exactly. And we're also keeping a close eye on your blood pressure and heart rate the whole time.
Makes sense.
Looking for any unusual changes.
You're monitoring all the vital signs.
Right. We want the full picture.
What else do you look for during the test?
We'll also ask you to tell us about any symptoms you're feeling.
Okay, like what?
Things like chest pain,
Oh.
shortness of breath, dizziness.
So basically anything that feels off.
Exactly. And sometimes we might use some imaging techniques too.
Like what kind of imaging?
Like an echocardiogram
Oh.
or a nuclear stress test.
I gotta be honest.
Yeah.
The word nuclear always makes me a little nervous.
I get it.
Can you explain what that is?
Of course. It sounds scarier than it is, I promise.
Okay. Right.
It's actually very safe and common.
Okay.
Basically, we inject a tiny amount of a radioactive tracer.
Radioactive, huh?
It's called technetium 99 meters,
Okay.
and it emits these gamma rays.
Right.
And then we use a special camera
Uh-huh.
to see how this tracer is flowing through your heart muscle.
So you can see if there are any blockages?
Exactly. Or areas where blood flow is reduced.
That's pretty amazing.
It is.
So with all this monitoring and the imaging,
Right.
what are the main things you're trying to learn from these tests?
We're looking for three key things.
Okay, lay them on me.
First, we want to see if there's any coronary artery disease.
Coronary artery disease.
Yeah. It's basically when the arteries that supply blood to your heart muscle get narrowed.
Like a traffic jam in your arteries.
Perfect analogy.
So the test can spot that early on.
That's the goal, catching it before it becomes a bigger problem.
So how does the test actually reveal that traffic jam?
It's all about the patterns.
Okay.
We're looking at your heart's electrical activity and blood flow,
Uh-huh.
both at rest and during exercise.
Right.
If a part of your heart isn't getting enough blood when it's working harder,
Yeah.
it'll show up as an abnormality on the ECG or in the imaging.
So you're comparing how your heart performs under different conditions.
Exactly.
That makes a lot of sense.
Good.
What other insights can you get from these tests?
Well, we can also see if you have any heart rhythm abnormalities.
For rhythm abnormalities, huh?
You know, like when your heart skips a beat.
Oh, yeah. I get those sometimes when I'm stressed.
Exactly.
Yeah.
And this test can pick up on those irregularities.
Even the subtle ones.
Yep. And we can figure out if they're anything to worry about.
Okay, so what kind of abnormalities are we talking about?
There are a few.
Uh-huh.
Common ones are arrhythmias,
What arrhythmias?
like atrial fibrillation
Okay.
or ventricular tachycardia.
Wow, those sound serious.
They can be, but not always.
Right.
That's why the test is so important.
And what was that third thing you mentioned you could learn?
Ah, yes. Your exercise capacity.
Exercise capacity. What's that?
Basically, how much exercise your heart can handle.
Oh,
It's not just for athletes either.
right. I was going to say.
It helps us understand anyone's cardiovascular fitness
Gotcha.
and make sure they're exercising safely.
So it's about pushing yourself, but not too much.
You got it.
I like that.
It's all about finding that balance.
So are there any risks with these tests, since you're pushing the heart?
That's a great question.
Yeah.
The good news is they're generally very safe, and they're non-invasive too.
Okay, that's reassuring.
Of course, there are always potential risks with any medical procedure,
Right.
but with these tests, yeah.
The risks are usually minimal.
Okay.
And the benefits really outweigh those risks.
Especially with early detection, right?
Exactly. Finding problems early can make a huge difference.
It seems like these tests are really about giving people more control over their heart health.
I couldn't agree more.
So much better to be proactive.
Absolutely.
Knowing how your heart works can really empower you.
It really can.
Speaking of knowing how your heart works,
Yeah.
it makes me wonder
What's that?
if people knew how their heart responded to stress.
Interesting question.
Yeah, like would they change anything in their lives?
But like what they eat.
Maybe. Or their exercise routine.
Yeah, would they be more careful?
Or maybe even just feel more confident in managing their health.
That's a great point.
It's something to think about, right?
It really is.
We've learned a lot today about these tests.
We have.
And they really give some incredible insights.
They do.
It's amazing what we can learn about the heart.
It is.
And understanding how it responds to stress.
It's a powerful tool.
It can change how you approach your health.
Exactly. So I hope this deep dive has given you the knowledge you need
For sure.
to make good decisions about your heart health.
That's what we're here for.
Because knowledge is power, right?
Absolutely. The more you know.
The better choices you can make.
Exactly.
So keep learning and stay curious about your health.
And take care of your heart.
That's the most important thing.
Couldn't agree more.
Thanks for joining us today.
Thanks for having me.
And we'll see you next time.
On the next deep dive.
Bye for now.
See ya.
You've been listening to the Learning Podcast, a production of metaNESTA. Remember, learning is a journey. One step, one insight, one skill at a time. We'll see you next time. Keep learning, stay curious, and as always, be awesome.